Bacterial invasion eats away at the flesh.
It's remarkable how quickly it can move.
Surgeons race to save life and limb.
We have to decide, is it limb or is it life?
A young woman's body begins to seize up,
Basically, you're mummified.
trapped inside a failing body.
It's a disease that's not curable and you don't know how you get it.
When a body like this is not big enough,
This is not vanity. This is a psychiatric disorder.
the man who can't stop pumping iron. Spray-on skin.
And there was just, bits of skin that just seemed to be dripping off my arms.
An incredible treatment for burn patients.
Certainly without active treatment, you could not guarantee traces survival.
And human extremes.
I do enjoy being torn, and you can have quite a bit of fun occasionally.
Although I'm small, I've got such a big personality.
The most incredible species on the planet is human. A disease that moves so fast it can kill within hours.
It's remarkable how quickly it can move.
A tiny break in the skin, normally no more than a minor irritation.
So it was just more or less bad luck.
And a cascade into the depths of a medical emergency.
His body was shutting down.
This is the horror of a flesh-eating disease. Bo Salisbury was just 43, happily married with 3 kids. Life was good. He loved his sports, and he kept fit. Until one day, a neighborhood soccer game set off a chain of events that could kill him. He got a kick in the ankle. It seemed like nothing. An injury so small he barely noticed it. But back at home, he was soon in excruciating pain.
For the amount of pain that he had and what happened to him, it didn't add up. He shouldn't have been in that kind of pain for just the simple injury that he had, the kick in the leg.
His local emergency room at first thought it was just a minor sports injury. He was told to rest and take some painkillers, but that didn't work. The next day, he was in absolute agony.
It was just too strange that they couldn't figure out what was going on with him. It just didn't make sense to me at all.
Something was terribly wrong. Bo was admitted to the hospital for tests. His blood pressure was dropping, and by next morning, his organs were failing. Bo was rushed to UC Davis Medical Center in Sacramento.
Bo was extremely sick. He was in what's called septic shock, where when he was first admitted to the hospital, he could not hold a blood pressure. So his body was shutting down.
He was very close to death.
When the lab tests came back, the news was very bad. Bo had necrotizing fasciitis, a flesh-eating bacteria. It could kill in less than 24 hours. The bacteria lurks everywhere. It's a mutated strain of the same bacteria that causes a common sore throat. Very rarely it attacks through open wounds. Just why is a mystery.
Well, first of all, antibiotics don't work for this disorder alone. You have to cut away the bacteria that are invading the limb, and you have to cut away the tissue until you get to tissue that's not infected. So it often involves amputating a limb.
Time was critical. With this disease, every minute counts. The bacteria was quickly eating up Bo's leg. It can devour up to 1 square inch of flesh every hour. Quick and aggressive surgery was his only hope.
And it's very important that we very aggressively debride, or in other words, remove the tissue from these wounds in order to save the person's life, if the life can be saved.
Bo went through 5 separate surgeries to remove the infected tissue. All the flesh from his leg, right down to the muscle, was removed.
Most people who would have looked at this situation from the outside who have experience with necrotizing fasciitis likely would have suspected that he would not have survived.
The bacteria was racing up his leg and into his lower back. It looked like they were losing the battle. Bo was in a coma. He'd virtually been skinned alive. Doctors had taken skin grafts from all over his body. They were running out of healthy skin to cover the flesh that had been eaten. And then he went into toxic shock. And Bo looked like he was about to die. Later, Bo's fight for life takes an unbelievable turn. A disease that traps its victims inside their own bodies.
They're like a mummy. They have like a bandage being wrapped around their body, and it's getting tighter and tighter.
Skin, joints, and organs harden and contract.
It's like you die slowly. You know, basically you're mummified.
A young woman faces a terrifying illness.
You're a full mummy in the end. And I said, I don't want to die like that, you know.
Australian dental nurse Amanda Powell had saved for years to travel to Europe. But the 22-year-old's dream was about to be shattered. Within days of arriving in London, her body began to fail.
I couldn't walk down the street and I felt like there was like 100 kilos on my whole body and I just couldn't get out of bed, and then I noticed my hands were swollen and my joints were really sore. By Amanda Powell. Home video.
Amanda's own video diary charted the beginning of the disease.
It's just my joints are really sore. This is my hand. Can't put it straight. Just won't go straight anymore.
The doctors in London had no answers.
Still smiling, or hoping to get better again. Like,
Amanda's mother, Susie, flew to London to take her ailing daughter back to Sydney. By now, she was a shadow of the girl that had left on her big adventure. Unable to walk, she was admitted to the local hospital.
I was there for a week. They couldn't find what was wrong with me. They did all these tests, like from so many blood tests to taking my skin.
But finally, there was an answer.
And then on my dad's birthday, they diagnosed me. They said, you have scleroderma. And they said that it's a disease that's not curable and you don't know how you get it, but it's something to do with your joints and your skin.
Now, everyone knew what they were dealing with. A disease of the autoimmune system, scleroderma. It literally means hard skin.
When I asked a doctor that is my daughter gonna die, the doctor put his head down and he said to me, your daughter is very, very sick.
Amanda was treated with drugs, but she wasn't getting better. Her mother wanted answers.
I said, she's not getting better, she's getting really stiff. And I said, why don't you give me a second opinion? Why don't you, find out who can look after my daughter?
In desperation, Amanda's doctor sent her to the rheumatology department of Sydney's Westmead Hospital to see Dr. Helen Englert.
A lot of her joints had become contracted and she'd lost a lot of movement. She had restriction in the hands, restriction in the wrists, restriction in the elbows, and she had slightly bent knees, and she had slightly bent hips, which wouldn't allow her to straighten up fully.
While doctors don't know why some people contract scleroderma, they do know the disease typically targets young women. Research has uncovered part of the scleroderma riddle, and it's linked to collagen, a lack of which leads to wrinkles and saggy skin. But too much collagen is an even bigger problem.
We've all got collagen in our body, but in this case, what happens is the immune system seems to stimulate cells underneath the skin called fibroblasts to produce too much collagen, and no one's quite clear why that trigger happened.
The excess collagen causes the skin to become thick and tight, constricting the joints and restricting movement, but it can get worse.
It's actually a disease not only characterised by hard skin, but there's hardening of the internal organs as well.
And that's what's happened to Amanda. The disease was now attacking her lungs.
I couldn't even breathe, you know, it was just so tight.
With Amanda's condition deteriorating further each day, the medical team reassessed her treatment. The disease is traditionally treated by suppressing the immune system, in much the same way as cancer is treated. But neither drugs or chemotherapy worked for Amanda. So Dr. Englert sent Amanda across Sydney to St. Vincent's Hospital for a revolutionary treatment. Later, Amanda's body reacts to the new procedure in a totally unexpected way. Bo Salisbury's life changed after a neighborhood soccer game. What began as a kicked ankle quickly turned into a life and death struggle. Within hours, a flesh-eating bacteria had invaded his body. All the flesh from his leg had to be removed. His organs were in shock, and his family was prepared for the worst.
We had no idea what was going to happen at all, which way it was going to go.
But then, on day 4 of his ordeal, something unexplained happened. The bacteria just stopped dead in its tracks. It was an incredible break. As quickly as it had started, the bacterial assault was over.
It's a rare disease, and he is a very, very unique individual to recover from this, considering how sick he was without having to have an amputation.
It's proof of a miracle, that God still does miracles. And they're medical miracles.
Bo had survived, but the pain and suffering wasn't over. Not by a long shot. He'd be in the hospital for 3 months.
And then once the skin grafting is completed, you have to lay still. So I laid still for about 2 months, completely still, and became completely deconditioned. So then you begin the grueling task of rehabilitation. And that's where the hard work is. I had to learn, I told my daughter I never dreamed I'd be 43 years old and learn how to put on shoes, brush my teeth, learn how to walk again. And so that went for probably about a year, that process of getting back to a semi-normal life. And I still didn't feel normal for probably about 3 years.
Bo amazed everyone with his determination. He not only managed to walk again, he now runs on a leg that only has a very thin layer of skin covering the muscle.
I did not think that he was ever going to be the same. I mean, couldn't have imagined that he could be what he is today, what he's doing today.
Bo still has his painful moments. He has nerve damage in his arm from having to lie for so long while the grafts healed. He also has to treat his grafted skin daily. But Bo is just glad to be alive.
There isn't a day goes by, just simply because of the way it looks, that I don't remember this, that it's a big part of who I am. And I'm constantly amazed that I can not only walk, but I can run, I can jump, I can do things that I never thought I'd ever do again.
We really think that it was a miracle, that God really healed him.
The doctors still don't know why the bacteria stopped spreading when it did. They'd performed some amazing surgery, but how Bo survived is a medical mystery.
When we see a patient like Bo get out of bed and walk for the first time, it's the most gratifying, remarkable experience that we can have. It's really what makes being a physician, being a surgeon, worthwhile.
Don't take life for granted, and don't think that it can't happen to you. This was never going to happen to me. Never.
What if you were never satisfied with your body?
I just had this compulsion just to be bigger.
If every day you looked in the mirror and saw a distorted reality.
This is not vanity. This is a psychiatric disorder.
No matter how much you dieted or how long you worked out, you could never be happy with your appearance.
These are normal-looking people, if not good-looking people, who really believe they perceive themselves as defective.
This is not anorexia, it's bigorexia, the psychological opposite. Anorexics think they're too fat, but Ken thinks he's too thin.
I'd like to be normal. I sometimes wish I was just normal.
Ken Clark does not see himself as having a fit and muscular body. But you only have to take one look at him to know that isn't true.
What I wanted originally was for my chest to stick out more than my stomach.
Ken has been lifting weights since he was 20.
I was average build for my age, but I felt like I was skinny. The changes that happened just seemed so slow and so small that even from year to year, I didn't acknowledge that there was any dramatic change.
Ken's desire to be bigger became an obsession he could not escape. He was suffering from bigorexia, a form of body dysmorphia.
Body dysmorphic disorder is a severe psychiatric disorder where an individual has a preoccupation with imagined defect in their appearance.
Although Ken had a body most people would envy, he still believed he was small and puny.
These are people who spend hours working out, sometimes to the point where they hurt themselves, they injure themselves. A lot of times they use excessive supplements, and a lot of times they turn to steroids.
I just had this compulsion just to be bigger, and just like a gambler has a compulsion to put a bet on. I got up in the morning, and the first thing that was on my mind was, I need a proper breakfast.
This is only the beginning of each obsessive day. Food is fuel, followed by exercise.
Then you would be thinking, well, what have I got to train a day? Chest today. What am I going to do for chest today? Am I going to do the same as last week or something different?
Ken spent years of frustration and unhappiness, unable to accept that he was big. When in fact he was so big, he was competing and placing in bodybuilding competitions. He just didn't hear the compliments.
All the competitions, no matter how good I've thought you are, it's just like a voice, and my voice is just echoing around this room because I don't think he's not hearing what you're saying.
7 years ago, Ken learned about the condition bigorexia. His years of obsessively training, dieting, supplements, and steroids finally made sense.
I felt it was a bit of a relief when there was actually a name for it, because I felt like this is a recognised problem. It's not something that's just peculiar to me.
Although Ken now knows why he obsesses with his body, he still can't stop.
And if you look down at your arms, sometimes I still don't see like a 19-inch arm. I still don't see a guy who you would say looks like Mr. Britain or Mr. Universe. I still don't see myself as being that good.
And like any obsessive behavior, it affects Ken's whole life.
If you're not able to stop thinking about anything else except your appearance, it's difficult to work. It's sometimes difficult to leave your house if you don't want to be seen. Very difficult to be intimate and to have relationships.
Ken's wife, Lisa, understands his obsession. A former female bodybuilder, she works with Ken at their gym. Lately, Lisa has seen a positive change in Ken.
The last two competitions, it's not been as bad. It's not been as bad, and I think that's because he's accepted the muscle dysmorphia.
Bigorexia is treated with medication and behavioral therapy. It's a long process that will not guarantee a total cure from this condition. Ken knows that he won't be happy until he's won a major bodybuilding title. And even then, he could never give up bodybuilding, no matter how much it controls his life.
I would still like to be bigger. Yeah. It's like, I want that achievement. And I think in the back of my mind, there's still this little demon who says, you're still not good enough. And I'm hoping that when I do achieve a proper major title, that I'll accept that that is the way I look all the time.
Australian Amanda Powell was on vacation in London when her body began to change. Her skin hardened and her joints began to stiffen. Her parents took her home only to discover she was suffering from scleroderma, a rare autoimmune disease. She didn't respond to drugs. Now she faces a new treatment, one never before tried in Australia. The plan is to harvest stem cells from Amanda's bone marrow, store them, and then re-inject the cells into her body in the hopes of dampening her immune system and beating the disease.
What happens is those cells make their way to the bone marrow and grow a new bone marrow, and we think probably grows a less aggressive immune system, although we don't entirely understand how the procedure works, and there was a chance of dying from the procedure. So this was not something to be taken lightly, and we had lengthy discussions with Amanda and her family about that.
With the stem cell transplant, they said 50% chance, you might die, or 50% chance that you will live.
Amanda's gutsy, and I admire her very much. She was willing to take those risks.
After the transplant, Amanda noticed an immediate change, but it wasn't what she or her doctors had been hoping for.
My whole body just felt really stiff, like anything. I couldn't even stretch, lie back. It just felt like if I lied back that my skin would rip because it was that tight.
This further tightening was placing even more stress on Amanda's organs. Her kidneys suddenly failed. It was devastating news for everyone.
They said, Amanda's going to be on dialysis for the rest of her life, and Mum was really upset with it.
I had Amanda still very bound in a skin of steel and her kidneys having packed up, and I thought, I've made this lass worse.
Okay, so just took this up.
But just as suddenly as Amanda had declined, the treatment seemed to work. She began to get better.
Over a period of time, her kidney function improved, and it's now improved virtually back to normal.
Dr. Englert at last had some good news for Amanda.
Wow, in 2 weeks we'll take your dialysis off, and I said yes. Oh my God, you don't understand. That was like the best day of my life because I hated it so much.
And more good news followed.
Well, we always told her that we wouldn't think that it would happen for at least a few months.
And I could bend my, knee and it wouldn't hurt as much. I started to feel all that. And I was like, oh, this is good,
Okay, let's have a look at your hands now.
Amazingly, her skin had begun to soften just a few weeks after the stem cell treatment. The gamble had paid off, and the medical team was astounded at its success.
The response in Amanda's skin is almost miraculous. The hard skin has disappeared. She doesn't even have hard skin now over the fingers, which is probably the most amazing part.
The only reminder of her ordeal is Amanda's hands. Her finger and knuckle joints remain constricted.
They're still researching on my hands. They did surgery on this one. Actually, I asked for it. I just want to be able to use it and, see if I can go back to dental nursing because, I studied dental nursing.
Amanda is now back in the swing of things and enjoying life to the full.
It makes me really proud to see her. She's back in studying again, and she tries very hard to be back to normal again, you know.
It's so good to have my legs back. But now, like, you know, I can go dancing and, you know, I mean, my legs don't feel sore or anything, you know, but yeah, I can still move.
Third-degree burns, the most terrifying of injuries.
I immediately then started to see that the skin on my arms just seemed to be, it seemed to be bubbling.
A life-threatening assault on the human body.
Eventually, you don't have any capacity to deliver oxygen and nutrients to your tissues because the circulating volume is diminished.
A terrorist attack threatens the survival of an Australian woman.
We were being, you know, thrown onto the floor, and just havoc wreaked straight after.
An amazing treatment that could save her from hideous scarring.
That really looks into the area of tissue engineering and skin culture.
Okay, what are we going to get? Maple syrup.
Tracy Ball looks just like any mum with an 8-year-old daughter. But 3 years ago, she suffered life-threatening burns to 1/3 of her body. The scars could have deformed her completely. But thanks to a surgeon's miracle treatment, Tracy's alive and can tell her story today. The year 2002. The place, tropical Bali, a dream vacation destination. But for 28-year-old Tracy Ball, from Australia's most western city, Perth, Bali was to become a dreamer's nightmare.
It was going to be just this wonderful family holiday.
That never happened. On the first night she was there, Tracy went to a club. It should have been a night of joy, but it became a night of tragedy.
You know, one minute you were standing there, you know, talking to your sister, having a drink and surrounded by people laughing and dancing and having a good time. And the next instant you were surrounded by nothing but, you know, fire and you know, rubble and, you know, people that were, you know, blown to pieces, basically.
A terrorist bomber had delivered his deadly message.
The roar in my ears, you know, this sound in my head was just, it was awful. I mean, I could hear the crackling of the fire and I could hear people screaming, but also within my own head, this just ringing, not knowing at the time that both my ears had been, both my eardrums had been perforated.
Tracy had suffered third-degree burns to 1/3 of her body. Her vital organs were now under direct threat from extreme trauma. Her life was on the line.
I saw, you know, the skin from the bottom of my foot just come off my foot, you know, because my foot slipped off this, you know, bit of bamboo which I was using to sort of give myself a leg up, and my foot slipped off, but all this skin from the bottom of my foot stayed there, and I thought, whoa, you know, that's not normal.
That was just the beginning.
And then these blisters had started popping, and there was just, you know, bits of skin that just seemed to be dripping off my arms and my hands.
And then the dreadful truth dawned.
Oh, this doesn't look good, you know, this looks really bad. I started to realise that it wasn't just my arms and my foot, it was obviously on my back as well, but I couldn't see my back.
The danger with burns is the fact that you're no longer waterproof and you no longer have a barrier for infection. You've lost that integrity of your skin. That results in a huge toxic response in the whole of your rest of your body systems, your heart, your liver, your lung, your kidneys.
Roy, we need to check on blood availability.
Tracy was medevaced to Perth, Australia, in a full-scale emergency. It was going to be a race against time. As luck would have it, Perth is home to Fiona Wood, burn specialist and world leader in burns technology. Tracy was going to need all the help she could get. Later, Fiona Wood and her team attempt to give Tracy an incredible new skin. Giles Morrow came into this world a healthy, happy baby, but you could tell straight away he looked different. He'd inherited Treacher-Collins syndrome from his mom.
Giles has a much more dramatic case of Treacher-Collins, and people that would meet him for the first time would certainly notice that there was something different about him.
Treacher-Collins syndrome is a genetic disorder that's passed on through generations. It stops the bones in your face developing properly. Surgery is the only answer.
I think that the most obvious part of Treacher-Collins is the deficiency of a prominent cheekbone and the deficiency of the chin. If you improve those two things, you can make a substantial improvement on the person's overall appearance.
Giles had his first surgery at age 10. Doctors put rib bone grafts in to fill out his facial features. But over the years, they dissolved. His Treacher-Collins features returned. But luckily, there's new surgery that can fix his face for good. Silicone implants like these are put in to build up the chin and jawbone. Scar tissue grows over the implants and fixes them in place. And similar type implants are inserted onto the cheeks. They build up the bones and finish off where nature didn't for people like Giles. This amazing surgery is almost a minor procedure. Patients are in and out the same day. And best of all, there's no scars left on the face. Using specially developed surgical instruments, the implants are inserted through the gums, so recovery is quicker and less painful. After a couple of days, Giles was all smiles.
Once the swelling goes down and once the bruises go down and you look at the results are really tremendous. I mean, I couldn't have hoped for anything better. It was like a dream come true.
Yeah, I'll take them off for a second. Come a little bit closer.
After years of feeling self-conscious about his appearance, Giles now has the face he's always wanted.
Looks terrific. It does look great, Doctor. Thank you.
You can put the glasses back on.
Giles also has the self-confidence to go after the new job he'd been dreaming of for years.
After the surgery and my new appearance and the confidence that it gave me, I decided I needed a change. I went out on a few interviews, and on the second interview I had, I was able to get a transfer to a better paying position within the state of New York. Things are going great.
When we do plastic surgery, whether it's facelifts or reconstructive surgery, we're always treating the mind at the same time. We're making people feel better about themselves.
This incredible surgery has given Giles a new lease on life. It's a godsend for him and others with Treacher-Collins syndrome. He can now walk down the street and feel just like everyone else.
I don't say that you can 100% make the markings disappear, but overall, though, you can improve your appearance 80, 90, 95%. To the point where the only person that really knows they have Treacher-Collins is you yourself.
In 2002, Tracy Ball was a victim of a terrorist bombing in Bali. Horrifically burned, she was medevaced to Perth, Australia. Luckily for Tracy, Perth is the home of Fiona Wood, a world-leading burn specialist.
Tracy suffered 30% body surface area injury. That has a profound impact on her vital organs. And without support and resuscitation and infection control, that is a potentially lethal injury without question.
Burn treatment is tricky. It's not only about saving the patient's life. That's just the first step. It's also about saving the patient from hideous and life-changing disfigurement. And for that, time is critical.
If a burn wound takes 10 days to heal, it's got a 4% chance of a significant scar. If it takes 21 days, you're looking at a 78% chance of significant scar.
This is a patient who suffered burns of similar magnitude to Tracy's. Dr. Wood knew Tracy herself could be facing that sort of scarring. And her injuries called for more than traditional skin grafting.
The problem with traditional split-thickness skin graft is you have to look at an area of the body that is not injured to harvest that split-thickness skin graft. And if you have a whole arm that is burnt, then you have to find an equivalent surface area to repair that wound. And so that compromises the person as well.
But Dr. Wood has pioneered a revolutionary treatment for helping burns heal quicker and with less scarring.
And we've been able to grow the skin cells in 5 days. So we're able to use the technology in large surface areas from day 5 onwards and really impact upon the quality of the scar that's worn for life.
A healthy skin surface constantly replaces itself. So Dr. Wood had a brainwave.
We all the time are growing skin. Well, our surface is replacing constantly. So we know there is an innate potential for that skin to keep replacing itself.
Dr. Wood's team takes the skin into the lab, harvests the cells, and then cultures them. In 5 days, enough cells have grown to cover a large wound. The cells are mixed in a solution and then sprayed onto the patient's wounds.
They're individual cells, they stick down onto the wound because they're primed to finding a surface. They then multiply and they migrate across that surface. When they connect with their fellows, then they start to thicken up and provide that waterproof layer that we need to protect us from our external environment.
Combined with traditional skin grafting, this procedure worked really well, and it was quick. For Tracy, that was a godsend.
Certainly without active treatment, you could not guarantee Tracy's survival, and the survival would be severely compromised. And if she was to survive without aggressive and active treatment, the quality of that scarring would be significantly impaired.
And there's another bonus in this technique. Burn scars look different from surrounding skin, and the reason is obvious. Often the skin graft has to come from a different part of the body, and that skin may not be the same pigmentation or texture as the skin that's been burned. Dr. Wood's spray-on skin needs only small quantities, usually taken from near the wound, so it's the same type. The result? A less obvious scar. Tracy began to pull through, but like everything, there could be no gain without pain. Every day for more than a year, she had to face the agony of having her dressings changed.
It got to the point where I ended up on one particular day having a panic attack because I knew what was coming. It was excruciating, even with all the pain medication that we were given. It still hurt, but they had to do it.
The burn ward is no place for the faint-hearted. There's no let-up when you're treating burns like Tracy's.
The problem with scars is that they are relentless. Once established, you can never eradicate, you can never remove it. You can disguise it, you can change it, you can move its direction, you can inset gussets of normal skin to damp it down, you can massage it, stretch it, push on it, inject it, but you can never take it away.
Dr. Wood was determined to give Tracy her best shot.
We're looking for the Holy Grail. In that, if we can achieve scarless healing, then we'd all be happy.
But for now, she knows she has to be a bit more realistic.
So we work a lot on quality. You know, the quality of the scar must be worth the pain of survival is, it's painted on all our foreheads, because it is not enough to just survive a burn in 2005 or 2002, or for that matter, the issue really is to survive a burn in a way that you live life to the full.
Oh, that's looking actually quite good. It's just slightly bumpy here. Probably need a bit of
Gradually, Tracy has clawed her way back. She'll never be able to let up on physical therapy. She can't let her scars contract and restrict her movement. But 3 years later,
Thanks to Fiona and her team, I look normal to most people, and I guess I can get around without too many people noticing my scars. So I'm very happy with them.
given what might have been, it's a medical miracle.
I see me, the state, that I'm in now, and sitting here, to myself normal. I do think that it is a minor miracle, given that I remember what I was looking at and seeing sitting on this curb in Bali with my skin dripping off my arms, to sitting here now.
Which is like being sick but not knowing what hurts.
Everything seemed impossible on a blue day.
3 years down the line, and thanks to Fiona Wood's pioneering technology, there's now plenty of joy in Tracy's life.
She's accepted life's challenges and has moved through and beyond, and has come out the other side, as I say, with a positive energy that is a lesson to us all.
That is a good book. A lesson in cheering yourself up.
We humans come in all shapes and sizes. Mostly it's our genes that dictate how tall we turn out. And the results can be incredible. At 4'2" and 4'6", Amy and Phil Holden don't have to bow to any doorway. Not so for big Jeff Rudum at a whopping 7'1". And likewise for Britain's tallest homegrown. Chris Greener scrapes in at 7'6¼ We brought this unlikely group together in a London pub to share life's ups and downs.
So how long have you been here?
Oh, God.
How many wives have you been here?
7 years. Almost 7 years now.
Oh, really?
Yeah.
Longer than you, ain't
But
That's long. Yeah, just a little.
Both Amy and husband Phil were born with achondroplasia. It's the most common of the many genetic conditions that cause dwarfism. Only about 1 in 40,000 babies are born with it. Amy's from Arizona, and Phil is British. They met at a Little Peoples of America convention in LA and got married a year later.
Looking back in my family tree, there has not been any other members of our family tree that has had the achondroplasia gene or the dwarfism.
In my family, as in parents and sisters, there's no one.
These forms are relatively rare. If you take all children who are born, 3% of them will have a birth defect. Of those, 5% of them will represent forms of dwarfism or skeletal disorders. Some of these occur more commonly, like 1 in 10,000, and some of them are exceedingly rare and occur 1 in 100,000.
Scientists have recently identified the gene for achondroplasia, but the condition has no cure or vaccine. 80% of all little people have achondroplasia. It causes the long bones of the body to be stunted. Their arms and legs are short, while their other bones are average size. There's nothing average about Chris Greener. He's an incredible 7'6¼ inches. It made him Britain's tallest and earned him a living.
Because I've been tallest guy and held the title, and a recognised title from Guinness, I've been to Australia, South Africa, the States, the Far East, the Middle East. A lot of European countries doing promotions, films.
Tall people can be meant to be tall. Many families are very tall. That's called constitutional tall stature. That's just the way they are. But sometimes, if all the other hormones are normal, if the pituitary gland secretes too much growth hormone, while you're still growing, then you get what's called pituitary giantism.
The pituitary gland is situated at the base of the brain. It makes growth hormone. A tumor on Chris's caused excess growth hormone to be produced. He had radiotherapy to fix the tumor, and his pituitary gland returned to normal. Unfortunately, he didn't find out about his condition until he was 28. Jeff Rudum grew up in Maine. In fact, he just kept on growing up. He grew up so quick, he was 6 feet tall by the time he turned 10. It made him a hit on the basketball court.
But it also made life a little difficult because, I mean, you know, when you're as big as an adult at 10, people look at you kind of as an adult, but you're still just a 10-year-old kid. So you're kind of caught between a rock and a hard place.
For Jeff, hard places like door jams are a constant danger.
I used to bump my head quite a bit. I mean, when I was younger, it was just a matter of, I mean, now I think it's more subconscious that it's almost like a built-in radar at the top of my head. If I'm near anything that's remotely close to the top of my head, I duck.
Jeff doesn't have a genetic condition. He was just destined to be much taller than average. And that often makes life difficult with everything from buying clothes to fitting in a plane, train, or automobile.
I mean, every day is a challenge. Every day is you're trying to make a 6-foot world a 7-foot world.
And although things are changing, life can be difficult for those at the other end of the scale, too.
Pants you see, you're just like, oh, yes, those are great. You try them on and they fit in your hips and they fit everywhere else and they're really long. So you can't obviously take them if you're going out that night, unless you're a good sewer. I unfortunately am not.
Dressing a massive body also has its challenges. Chris gets most of his clothes tailor-made. Fortunately, there's no shortage of places to get that done in London.
Okay. Hey.
But for those born with genetic disorders, there are much more serious issues than clothes. The decision to have a family requires careful consideration of the medical odds. If both parents have achondroplasia, there's a 1 in 2 chance one of the parents will pass on the gene. And sadly, a 1 in 4 risk of both parents passing on the gene. This is called double dominance. It's generally fatal soon after birth. It took Amy and Phil's first son, Ben.
They ended up doing tests. They found out that he had the double dominant gene, and we knew at that point that he wouldn't survive. So, so sadly, that can happen.
But less than a year later, their lives changed again. They adopted Patrick, who also has achondroplasia.
It was quite exciting because it all just happened for a reason, so we count ourselves lucky.
The hurdles he's going to have to jump, we can see them coming up. So we can prepare him for them hurdles, whereas me and Amy had to hit the hurdles before we could learn to jump them. And I think, although Paddy, it's not going to be easy for Paddy, but me and Amy can help him a lot.
This group has one thing in common. They are all at the extremes of human size, but all have learned to cope in an average world, and all are proof that size really doesn't matter.